Assalamualaikum. My name is Muhammad Mubarak Ali bin Rahmatullah, and today I am making a video on a mini project for small bowel obstruction. So, what is small bowel obstruction? It's also called as SBO, which stands for small bowel obstruction. So this simply means a blockage in the small intestines. That's what small bowel obstruction means. Next, let's take a look at the symptoms of SBO. So you have a variety of symptoms which includes severe bloating, abdominal pain, nausea, decreased appetite, vomiting, diarrhea, constipation, severe abdominal cramps, and abdominal swelling. Some of the symptoms may depend on the location and length of the time of the obstruction. For example, vomiting is an early sign of small intestine obstruction. This may also occur with an obstruction with your large intestine. A partial obstruction can result in diarrhea, while a complete obstruction can result in an inability to pass gas or stool. Intestinal obstruction may also cause serious infection and inflammation of your body, known as peritonitis. This occurs when a portion of your intestine has ruptured. It leads to fever, abdominal pain, abdominal cramps, and so on. This condition is a life-threatening emergency that requires surgery. So next, let's take a look at the causes of intestinal obstruction. Okay, the first type we have the mechanical obstruction. Okay, mechanical obstruction is divided into first adhesions. Adhesions which consist of fibrous tissues that developed after any abdominal or pelvic surgery or after severe inflammation. Second, we have volvulus. Okay, this simply means the twisting of the intestines. Third, we have intussusception. Okay, which also means telescoping, or basically what happens is one segment of the intestines gets pushed into the next section. Okay, it's like cupping, pushing into one another. Fourth is tumors that goes inside your small intestine. Next we have hernia. Hernias involves a portion of your intestine protruding outside of your body or into another part of your body, or any inflammatory bowel disease such as Crohn's disease. Next, we'll take a look at non-mechanical obstruction. We have looked at mechanical obstruction, now we'll look at non-mechanical obstruction. Okay, basically your small intestines normally work in a coordinated system of movement. If something interrupts these coordinated contractions, it can cause a functional intestinal obstruction. This is generally known as non-mechanical obstruction. If it's a temporary condition, it's referred to as ileus. Once it becomes chronic or long-term, it's called as pseudo-obstruction. So let's just divide these into two. First one is ileus or temporary, and the second one is pseudo obstruction. Or long term or chronic. Okay, this is chronic stage. Okay, causes for ileus includes abdominal or pelvic surgery okay, infections such as gastroenteritis, appendicitis, and so on. Next, it could be some medication, okay, including like opioid pain medications and so on. And next, electrolyte imbalance. Whereas for pseudo obstruction, it can be caused by Parkinson's disease, okay, this is like, you know, multiple sclerosis, and also other nerve and muscle disorders, basically multiple sclerosis. Next we have Hirschsprung's disease. Okay, this disease is a disorder in which there are lack of nerves in sections of the large intestine. So the motility of the intestine is disrupted during this. Okay, next it can also be caused by disorders that causes nerve injury, such as diabetes mellitus perhaps. And last but not least, hypothyroidism. Okay, so next we'll look about how it is diagnosed, how SBO, small bowel obstruction, is diagnosed. Okay, first of all, the doctor may push your abdomen or palpitate your abdomen to examine it. Okay, examine your abdomen. Second, they might listen with a stethoscope to any sounds inside. Okay, stethoscope to listen to sound. And as for kids or infants, it's easier to diagnose small bowel obstruction with the help of examining the cavity of the body, which will show or which will manifest as a hard lump in the body, or also with some particular sounds. Okay, Okay, these two is mostly widely used in children because their bodies are smaller compared to adults, so you can palpitate them easily and see it better. Okay, next we're going to talk about what are the tests that you can do. What are the tests that you can do to confirm SBO? So first of all, they'll let you do some blood tests. Second, you'll have to do x-rays. Third, some CT scans of your body, some colonoscopy. Okay, this basically is just a flexible tube with light that they will insert it, okay, inside your colon to see inside. Okay, and next, enema with contrast. Okay, next we're going to talk about complications of SBO. So you might have dehydration, electrolyte imbalance, perforation. This is quite serious. Perforation in the intestine might cause your intestinal content to pour out into the cavity, abdominal cavity, that causes lethal infections. Next, you might even have kidney failure. And if the obstruction, for example, like volvulus, where the twisting happens, if the obstruction will prevent blood from getting into some segments of intestine, which can cause infection, tissue death, okay, or necrosis. Necrosis is due to insufficient amount of oxygen supplied to the tissue, so it dies. Okay, causes sepsis, organ failure if left untreated, and even death. Okay. Next, I'm going to talk about the pathophysiology of SBO. First, sequestration of fluid, or basically retention of fluid and gases proximal to obstruction. This causes dilation of bowel, together with abdominal distension. Third, the fluid shifts out of the bowel into peritoneum, which is also called as perforation, like I said. Okay, so this causes irritation of peritoneum, or basically just peritonitis, the inflammation of your peritoneum. So this causes vascular shifts into peritoneal cavity, which always ends in result hypovolemia. Okay, dehydration and septic shock. Okay, last but not least, we're going to take a look at the treatment of small bowel obstruction. So this depends on how severe the blockage is. Like I've said, it depends on the mechanical and non-mechanical obstruction, which could be, ileus temporary or long, okay, which is pseudo obstruction. So when doctor checks you, diagnosed you with what type of obstruction you have, you will have some options for bowel obstruction. The first includes medication. Okay, for example, like opioids. This can lead to constipation. If this occurs, laxatives and stool softeners will be given. Okay, so like I've said, opioids causes bowel obstruction, so laxatives will be given. Second, observation. Okay, the ileus may need monitoring for a few days and often resolves with time. Like I've said, ileus is temporary, so it doesn't need much medications. So, but during this observation time, the doctors will usually limit the food and drink intake to stop further build up. Okay, the next, the doctors will put a nasogastric tube, which is a narrow tube that goes down into the stomach from the mouth. Okay, like this, your mouth, all the way to your stomach. Okay, the tube goes to the stomach and it removes the fluid and gas that builds up in the stomach. Okay, next you have therapeutic enema. Okay, basically enema is a medication that will be pushed into the bowel to try to relieve the stool impaction. Okay, basically, as we all know, the doctors used to give this for people who have severe constipation and all. So this enema will soften the stool and make it easier to pass the stool. Okay, and also some anti-nauseatic medicines will be given. This is to prevent vomiting. Next, some pain relief medication. As we all know, this can be really painful. And last but not least, some antibiotic to fight infection. So that's all of my video today on small bowel obstruction. Thank you for watching.